Good day, everyone. Today, we're going to discuss about infectious disorders, what they are, some terms used to describe them, and different types of infectious diseases. My name is Aimee Angeli Hulaton, and I am with Miss Stephanie Ann Estolero. Okay, let's get started.
Brief discussion about infectious disorders. These are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. Many organisms live in and on our bodies. They are normally harmless or even helpful. However, some organisms have a tendency to cause diseases in certain circumstances. It is possible for some infectious diseases to spread from one person to another. It can be caused by bacteria, virus, fungi, and parasite. Bacteria is a one-cell organisms that are responsible for illnesses such as strep throat, urinary tract infections, and tuberculosis or TB. The human body is full of bacteria, and in fact, it is estimated to contain more bacterial cells than human cells. Most bacteria in the body are harmless, and some are even helpful. A relatively small number of species can cause disease. There are bacteria that are bad, that we call pathogenic, and they will cause diseases, but there's also a good bacteria. Viruses. It is smaller than bacteria, and virus is an infectious agent of small size that can only multiply in living cells, consisting of a segment of nucleic acid, either DNA or RNA, surrounded by a protein coat. A virus cannot replicate alone. Instead, it must infect cells and use components of the host cells to make copies of itself. Often, a virus ends up killing the host cell in the process, causing damage to the host organism. Fungi are the main cause of many different skin conditions, including ringworm and athlete's foot. Other types of fungi can infect the lungs or the nervous system of a person. They can be found in all sorts of places, but most of them like to live on land, primarily in soil or on plants, instead of living in the sea or fresh water. A parasite is an organism that lives on or in host organism and gets food from or at the expense of its host. It can be transmitted to humans from animal feces. There are three main classes of parasites that can cause disease in humans. Number one is protozoa, helminths, and ectoparasites.
How it is transmitted.
About direct contact. Direct contact is a contact with a person or an animal that is infected. It is one of the easiest way to acquire most infectious diseases. Infectious disorders can be spread through direct contact such as person to person. Person to person contact transmission of bacteria, viruses, or other germs from one person to another is the most common way that infectious diseases are transmitted. This can happen when an infected person touches, kisses, coughs, sneezes, and on someone who isn't sick. So, mata-transfer siya kapag nalagyan mo yung tao, umupo yung tao, and nabahingan ka ng isang tao. Dun mo makukuha yung direct contact. Next is animal to person. When an infected animal bites or scratches a person, it can make a person sick. So, kunyari kapag yung pusa may infectious disease na nakikarry yung pusa, then na-scratch ka niya or na-bite ka niya, pwede itong ma-transfer sa'yo. Next is mother to unborn child. An unborn child can get an infectious disease from pregnant woman. This can be passed through placenta or breast milk, yung pagpapadede ng mother. Next, we have indirect contact. Indirect contact occurs when there is no direct human-to-human contact, such as insect bites, food contamination. Insect bites. Some germs rely on insect carriers such as mosquitoes, fleas, lice, or ticks to move from host to host. Next, we have food contamination. disease-causing germs can also infect you through contaminated food and water. This allows germs to be spread to many people through a single source.
Exanthem subitum or the Roseola
So
infantum.
I'm going to discuss Exanthem subitum or Roseola infantum. Roseola infantum is common disease of childhood that is seen globally and is caused by infection with human herpes virus 6 or HVV6, or less frequently by human herpes virus 7 or HVV7. Transmission occurs primarily through saliva via respiratory droplets or yung mga droplets na galing sa ating bunganga. It has associated signs and symptoms such as cervical or post-auricular lymphadenopathy, inflamed pharynx, cough, coryza. Next, its rash has discrete rose pink macules or maculopapules. When we say maculopapules, it is derived from two words, which is macule. Macule means flat rash and papule means raised rash. So, pag pinagsama mo sila, maculopapules means rash with both flat and raised parts. So, as I said, the rash has discrete rose pink macules or maculopapules appearing first in the trunk, then spreading to neck, face, and extremities. So the laboratory tests are unlikely to be necessary for the evaluation of Roseola infantum, but are sometimes shown during the febrile phase of the illness to rule out other diagnoses. So there is no specific treatment for Roseola infantum. So if your child if the child is prone to seizures, discuss appropriate precautions, possibly or recurrent febrile seizures.
This is what exanthem subitum looks like. Rubella or German measles.
Rubella or German measles. Agent, rubella virus. Source, primarily nasopharyngeal secretions of person with apparent or inapparent infection. Virus also present in blood, stool, and urine. Incubation period is 14 to 21 days. Period of communicability is 7 days before to about 5 days after appearance of rash. Constitutional signs and symptoms, occasionally low-grade fever, headache, malaise, and lymphadenopathy. Rubella is a contagious viral infection best known by its distinctive red rash. It's also called a German measles or a 3-day measles. This infection may cause mild or no symptoms in most people. However, it can cause serious problems for unborn babies whose mothers become infected during pregnancy. Rubella isn't the same as measles, but the two illnesses share some signs and symptoms such as the red rash. Rubella is caused by a different virus than measles, and rubella isn't as infectious or as severe as measles. The measles, mumps, rubella, or what we call the MMR vaccine, is safe and highly effective in preventing rubella. The vaccine provides lifelong protection against rubella. Rubella is caused by a virus that's passed from person to person. It can spread when an infected person coughs or sneezes. It can also spread by direct contact with infected mucus from the nose and throat. It can also be passed on from pregnant women to their unborn children through the bloodstream. Clinical manifestations, prodromal stage, consist of low-grade fever, headache, malaise, anorexia, mild conjunctivitis, coryza, sore throat, cough, and lymphadenopathy. Lasts 1 to 5 days, subsides 1 day after the appearance of rash. Rash first appears on face and rapidly spreads downward to neck, arm, trunk, and legs. By end of first day, body is covered with discrete pinkish red macula papular exanthema. This appears in same orders as it began and is usually gone by third day. Therapeutic management and complications. No treatment necessary other than antipyretics for low-grade fever and analgesics for discomfort. Complications: rare, arthritis, encephalitis, or purpura. Most benign of all childhood communicable diseases, greatest danger is teratogenic effect on fetus. Nursing considerations: reassure parents of benign nature of illness in affected child, use comfort measures as necessary, and isolate child from pregnant women.
This is what rubella looks like. Measles or rubiola.
Next, we have measles or rubiola. Measles has the agent virus. Its source is respiratory tract secretions, blood, and urine of infected person. So, its mode of transmission usually by direct contact with droplets of infected person. Next, its incubation period is 10 to 20 days. So, tumatagal siya ng 10 to 20 days sa mga nadadapuan ng droplets like that. Next, the period of communicability is from 4 days to 5 days after rash appears, but mainly during prodromal stage. So, prodromal stage is the period after incubation and before the characteristic symptoms of infection occur. So, we have clinical manifestations. The first is prodromal stage. Nasabi ko na kanina kung ano meaning ng prodromal stage. Next is rash. So, we have also nursing considerations for measles. We have isolation until 5th day of rash. If hospitalized, institute respiratory precautions. Next is to maintain bed rest during prodromal stage. Provide frequent activity. We have fever, eye care, coryza, cough care, skin care. Next is we have therapeutic management or complications for measles. We have vitamin A supplementation. So, bakit nga ba kailangan yung vitamin A supplementation para sa batang may measles or sa person na may measles? So, vitamin A reduces the effect of measles infection. So, it is what we call therapeutic effect. Next, we have preventing the subsequent development of secondary infection. So, it is called what we call protective effect. So, next we have supportive therapeutic management, which is bed rest during febrile period, antipyretics, antibiotics to prevent secondary bacterial infection in high-risk children. So, we give antibiotics to prevent secondary bacterial infection para sa mga high-risk na children. Next, we have complications. For complications, we have otitis media, pneumonia, bronchiolitis, obstructive laryngitis, and laryngotracheitis, and encephalitis.
This is what measles or rubiola looks like. Chickenpox, also known as varicella.
Chickenpox or the varicella. Agents: varicella zoster virus or what we call the VZ virus. Source: primary secretions of respiratory tract of infected person. To a lesser degree, skin lesions, scabs not infectious, transmissions, direct contact, droplet or airborne spread, and contaminated objects. Incubation period is 2 to 3 weeks, usually 14 to 16 days. Period of communicability, probably 1 day before eruption of lesions, which is the prodromal period, to 6 days after first crop of vesicles when crusts have formed. Risk of becoming infected with the varicella zoster virus that causes chickenpox is higher if you haven't already had chickenpox or if you haven't had the chickenpox vaccine. Most people who have had chickenpox or have been vaccinated against chickenpox are immune to chickenpox. A few people can get chickenpox more than once, but this is rare. If you've been vaccinated and still get chickenpox, symptoms are often milder with fewer blisters and mild or no fever. Parents typically wonder whether vaccines are safe. Since the chickenpox vaccine became available, studies have consistently found it to be safe and effective. Side effects are generally mild and include redness, soreness, swelling, and rarely small bumps at the site of the shot. Clinical manifestations: prodromal stage, slight fever, malaise, and anorexia for first 24 hours. Rash is highly pruritic, begins as macule, rapidly progresses to papule and then vesicles, which is surrounded by erythematous base, becomes umbilicated and cloudy, breaks easily and forms crust, present in varying degrees at one time. Distribution: centripetal, spreading to face and proximal extremities but sparse on distal limbs and less on areas not exposed to the heat. For example, is clothing or sun. Constitutional signs and symptoms: elevated temperature from lymphadenopathy, irritability from pruritus. Therapeutic management and complications: specific antiviral agent acyclovir or the Zovirax, varicella zoster immunoglobulin or the VZIG after exposure in high-risk children. Supportive: diphenhydramine hydrochloride or the antihistamine to relieve itching, skincare to prevent secondary bacterial infection. Complications: secondary bacterial infections, cellulitis, necrotizing fasciitis, pneumonia, and sepsis, encephalitis, varicella pneumonia, which is rare in normal children, hemorrhagic varicella, and chronic or transient thrombocytopenia. Nursing consideration: maintain strict isolation in hospital, isolate child in home until vesicles have dried, which is usually 1 week after onset of disease, and isolate high-risk children from infected children. Administer skincare, give bath and change clothes and linens daily, administer topical calamine lotion or calamine lotion, keep child's fingernails short and clean, apply mittens if child scratches, keep child cool, which may decrease number of lesions, and avoid use of aspirin.
This is what chickenpox or varicella looks like.
Sum up the whole report, we have here the conclusion. So it is for us to differentiate what is Rosola infantum, measles, rubella, chickenpox. So we have the difference between the rash characteristics of these diseases. So first we're going to talk about the rash characteristics of Rosola infantum. A Rosola infantum rash is a discrete rose pink macules or maculopapules appearing first in trunk, then spreading to the neck, face, and extremities. Often starts on the chest and back and spreads out throughout the bodies. Next, we have the rash characteristics of rubella. Rubella rash is a deep red, flat rash that starts on the face and spreads down to the trunk, arms, legs, and feet. The rash starts as a small distinct lesions and which then combines as one big rash. Next, we have measles. A measles rash appears as flat red spots, and rash begins from head or face and moves downwards our body. Next, we have the rash of the chickenpox. A chickenpox rash starts with red bumps or papules that turns into itchy fluid-filled blisters or vesicles. And we're going to talk about the mode of transmission of these four diseases. We're going to start with the mode of transmission Next is the mode of transmission for rubella, which is direct or droplet contact from nasopharyngeal secretions. Next is for the mode of transmission for measles. It is by coughing and sneezing, close personal contact, or direct contact with infected nasal or throat secretions. Next is for the mode of transmission for chickenpox. The mode of transmission for chickenpox is by directly touching the blisters, saliva, or mucus of an infected person.
Thank you for listening. Bye. Mwah.